My dear friend, I want you to think about the medications you rely on daily, the pill for your blood pressure, the one for a good night's sleep, or even a simple one for allergies. We trust them to protect our health, but have you ever had that sinking feeling that your mind is getting foggier just as your prescription list gets longer? It's a terrifying thought, isn't it? That the very medicines meant to help could be the secret cause of your memory lapses and confusion. But here is my promise to you. By the end of this video, we will expose this hidden danger. We will identify the specific medications that could be harming you, and I will give you the knowledge to finally clear that fog and take back control of your cognitive well-being. So, get comfortable, and if you're ready to reclaim your clarity, go ahead and hit that like button. Subscribe to the channel for more life-changing tips, and let me know in the comments where you're watching from so I can give you a shout out next. Time. We're diving deep into a list of 13 common medications that, believe it or not, might be sabotaging your brain. I know it sounds alarming, but knowledge is power, and our goal here is all about empowerment for our beloved seniors. We want to ensure your journey is filled with longevity, happiness, and vibrant quality of life. This isn't about scaring you. It's about giving you the tools to champion your own healthy aging process. We're in this together, and the first step is always awareness. So, let's begin this crucial conversation about protecting that brilliant mind of yours. First up on our list are benzodiazepines. Oh, they have friendly names you might recognize, like diazepam or clonazepam. Doctors often prescribe them for anxiety or to help you get a good night's sleep, which sounds wonderful, right? They promise peace and quiet. But here's the rub. While they're quieting your nerves, they might be quieting your brain a little too much. This is a critical piece of the puzzle when we talk about maintaining your cognitive health and feeling your best every single day. True well-being means understanding both the benefits and the potential risks of what we put into our bodies. The long-term story with these pills can be a bit devastating. Think of them as putting your brain's activity on a dimmer switch. Over time, this can lead to some serious issues, including dependence, memory lapses, and even an increased risk of dementia. It's a tough pill to swallow, metaphorically speaking, because you're taking something to help, but it could be harming your chances at a long, sharp life. This directly impacts your independence, as a sharp and active mind is your greatest asset for navigating the world with confidence and joy. Next, let's chat about a sneaky category called anticholinergics. This is a fancy term for drugs found in many over-the-counter allergy and asthma medications. You might be taking one daily without a second thought, just to keep the sniffles at bay. They work by blocking a brain chemical called acetylcholine. The problem is, acetylcholine is like the brain's superstar messenger for memory and learning. Blocking it is like telling the mailman to stop delivering important letters. Things are bound to get lost, and that's a real threat to your mental health. When you consistently block this vital messenger, your brain struggles to form new connections. Studies have even suggested that long-term use could double the risk of developing Alzheimer's. Imagine that. A simple allergy pill, potentially steering you away from the path of healthy aging. This is why it's so important to question what we consider harmless and to always seek out healthy habits that support our longevity instead of inadvertently undermining it. Your long-term well-being is a treasure worth protecting with vigilance and care. Now, let's turn our attention to statins, the famous cholesterol-lowering drugs like simvastatin and atorvastatin. They are hailed as heroes for heart health, and for good reason. But our bodies are complex, and what helps one part might hinder another. Your brain, it turns out, is a bit of a cholesterol fan. It needs this substance to build and maintain healthy cells. When you lower cholesterol levels too drastically, you might be inadvertently starving your brain of a key building block, which can seriously affect your quality of life and day-to-day thinking. Some people on statins report a frustrating brain fog, a feeling of mental slowness and forgetfulness that's hard to shake. It's a classic example of how interconnected our systems are. It shows that true well-being isn't just about one number on a lab report. It's about the whole picture. Being proactive about your health is the cornerstone of healthy aging. For those of you who want to take an even deeper dive into creating a holistic plan for your vitality, I've put together a guide called Wellness and Aging: Valuable Tips for Seniors. It's packed with practical advice on nutrition, exercise, and keeping an active mind. The link is in the first pinned comment below. Let's talk about an older class of drugs, tricyclic antidepressants. You might know them as amitriptyline. While newer options are more common now, these are still used for things like chronic pain or migraines. The issue is, much like those sneaky anticholinergics, they also interfere with that all-important brain messenger, acetylcholine. This can lead to significant memory problems and a feeling of being mentally sluggish. It's a trade-off that can have a real impact on your pursuit of happiness and daily function. For many seniors, the sedative effect of these medications is particularly concerning. It can slow your thinking and affect your balance, which in turn impacts your independence. The goal of any treatment should be to enhance your quality of life, not to swap one problem for another. It's about finding a balance that allows for both emotional and cognitive well-being. If this information is resonating with you, a quick tap on the like button helps more people find this crucial advice for their health. Now for corticosteroids, like prednisone. These are powerful anti-inflammatories, absolute lifesavers for conditions like severe allergies or autoimmune diseases. They work wonders by calming down an overactive immune system. However, their long-term use can be a double-edged sword for your brain. They can directly influence your brain chemistry, and not always for the better. This is a critical conversation for anyone on these medications who values their long-term cognitive health and mental clarity. Here's the scary part. Prolonged use of corticosteroids can actually lead to the shrinking of the hippocampus, your brain's memory headquarters. This can cause significant memory deficits, mood swings, and confusion. It's a heavy price to pay for relief. This highlights the importance of exploring all avenues for healthy aging, including nutrition and other lifestyle changes that can naturally reduce inflammation, supporting your body's journey toward greater well-being and sustained happiness. Let's move on to something many people use for heartburn: H2 blockers, such as ranitidine. They seem so benign, right? You take one to soothe your stomach after a rich meal. The problem is, they can interfere with your body's ability to absorb vitamin B12. And let me tell you, vitamin B12 isn't just any vitamin. It's absolute rocket fuel for your brain. Your brain desperately needs it to maintain healthy nerve cells and function properly, which is foundational to a good quality of life. A deficiency in B12 can mimic the symptoms of dementia, causing memory loss, confusion, and nerve damage. You could be thinking you're facing a serious cognitive decline when the real issue might be a nutritional deficiency caused by your heartburn medication. This is a perfect example of why a holistic approach to health, which includes monitoring your nutrition, is so essential for seniors. It's about connecting the dots to protect that wonderful, active mind of yours. What about medications for urinary incontinence, like oxybutynin? They can be a real blessing for restoring confidence and independence. However, they operate with a strong anticholinergic effect, which we now know is bad news for the brain. They are essentially putting the brakes on acetylcholine, that crucial neurotransmitter for memory. This is a direct challenge to the goal of healthy aging, as it can significantly increase the risk of dementia while trying to solve another problem. The result of taking these medications can be a slow and silent erosion of your cognitive function. You might feel a bit more forgetful or confused and simply blame it on age, but it could be the medication you're relying on. It's a difficult situation as it pits your physical comfort against your mental acuity. This is where exploring other healthy habits, like targeted exercise for pelvic floor strength, can be a game changer for your long-term well-being and longevity. Next on our list are fluoroquinolones. These are heavy-duty antibiotics, like ciprofloxacin, used for serious bacterial infections. When you're really sick, you need a powerful tool, but these drugs can have some alarming effects on the central nervous system. They can sometimes cause episodes of severe confusion, hallucinations, and even nerve damage, which is a serious blow to anyone's sense of self and independence. These powerful antibiotics should truly be a last resort, reserved for infections where other, safer options have failed. The potential for neurological side effects is a significant risk to your cognitive health and overall well-being. It's a stark reminder that more powerful isn't always better, especially when it comes to the delicate ecosystem of our bodies. Making informed choices is a cornerstone of achieving a life filled with happiness and vitality. Let's look at calcium channel blockers, such as amlodipine, which are widely prescribed for high blood pressure. They are vital for cardiovascular health, helping to relax blood vessels. However, by doing so, they can sometimes reduce blood flow to the brain. This can lead to a kind of mental fatigue and confusion, making it harder to maintain that sharp, active mind we all strive for as we age. It's a subtle effect, but one that can diminish your daily quality of life. The reduced blood and oxygen supply to the brain is a serious concern for seniors, who may already be at a higher risk for cognitive issues. It's another one of those tricky balancing acts in medicine. You're trying to help your heart, but you might be shortchanging your head. It emphasizes the importance of a comprehensive approach to health, one that includes exercise and nutrition to support circulation naturally. And hey, if you're finding this helpful, let me know in the comments what topic you'd like me to cover next. Now for those sleeping pills that aren't benzodiazepines, like zolpidem. They were designed to be a safer alternative for treating insomnia. They help you fall asleep, but the quality of that sleep and the side effects can be problematic. They can lead to what's called anterograde amnesia. This is a frightening condition where you can't form new memories after taking the pill. It's a huge risk for your safety and your sense of well-being. People have reported doing all sorts of things after taking these pills, eating, walking, even driving, with absolutely no memory of it the next day. Can you imagine? That's not just a memory issue. That's a serious threat to your independence and safety. Furthermore, they significantly increase the risk of falls in seniors, which can lead to a cascade of other health problems, disrupting the journey toward longevity and happiness. Interferons are another class of powerful drugs, often used for autoimmune diseases like multiple sclerosis. They are critical for managing these complex conditions. However, they work by activating the immune system, and this can trigger inflammation throughout the body, including in the brain. This neuroinflammation can be a major source of cognitive problems, directly impacting your ability to think clearly and enjoy a high quality of life. This brain inflammation can manifest as that all-too-common brain fog, but it can also increase the risk of depression and anxiety. It can feel like your mental energy has been completely drained. For anyone undergoing this treatment, focusing on other healthy habits that reduce inflammation, such as a targeted anti-inflammatory nutrition plan, can be an essential supportive measure for protecting your precious active mind. What about metformin? It's one of the most common drugs in the world for type 2 diabetes and is often seen as very safe. However, its long-term use holds a hidden danger we must discuss. Over many years, metformin can significantly impair your body's ability to absorb vitamin B12. And as we've already learned, a B12 deficiency is terrible news for your brain's health and your long-term well-being. This lack of B12 can cause neurological damage and memory loss that looks distressingly similar to Alzheimer's disease. So, while you're diligently managing your blood sugar, you could be unknowingly creating another serious health issue. This is why regular monitoring and perhaps supplementation, with a doctor's guidance of course, are non-negotiable healthy habits for anyone on this medication for the long haul, ensuring your path to longevity remains clear. Finally, let's talk about the number one medication group on our list for its potential impact: general anesthetics. Drugs like propofol are miracles of modern medicine that make complex surgeries possible and painless. They are absolutely essential. However, going under anesthesia can be a significant event for the brain, especially for seniors. It can sometimes lead to a period of post-operative cognitive dysfunction, a state of confusion and memory lapses. For some, especially those already at risk for neurodegenerative diseases, the brain doesn't quite bounce back to its former state. The anesthesia can induce an inflammatory response in the brain that may accelerate cognitive decline. It's a sobering thought when facing a necessary surgery. This is where preparing your body and mind beforehand with good nutrition and cognitive exercise can play a supportive role in your recovery and overall health. So, there you have it. A look inside the medicine cabinet that might just change the way you view your health. The point of all this isn't to make you throw your pills away, but to empower you to have smarter, more informed conversations with your doctor. It's about being a co-pilot in your journey of healthy aging, not just a passenger. Your longevity and happiness are profoundly linked to your independence, and that independence is rooted in a sharp, active mind and a healthy body. This knowledge is your superpower. It's the key to unlocking a higher quality of life. So, my question to you is, what is one small, proactive step you can take this week for your brain health? Let me know your thoughts in the comments below. I love reading every single one. Please don't forget to subscribe and ring that notification bell so you don't miss our next video, where we'll be talking about the top 5 brain-boosting foods you should be eating every day. It's the perfect follow-up to today's discussion.